Guys, Nurse Alyssa here. I'm going to be starting a wound care micro learning series for nurses. So this is episode 1 of the series. If you've ever felt unsure about where to start with wound management or wondered what your exact role is in the healing process, this session is for you. In just a few minutes, we'll cover your role as a nurse, the main goals of wound management, and the key principles that guide every great wound care plan. As nurses, we're at the front line of wound care. Our role goes far beyond simply changing dressings. We assess the wound, identify barriers to healing, implement evidence-based interventions, and monitor outcome. We also play a critical role in education, helping patients and families understand how to care for wounds safely at home, prevent infection, and support healing through nutrition, pressure relief, and adherence to treatment. Remember, wound care is a team sport. We collaborate with physicians, dietitians, and therapists to create the best possible outcome in every patient. The goals of wound management. The goals of wound management are actually quite simple but powerful. First, promote healing by creating an ideal environment for tissue repair. Second, manage symptoms such as pain, exudate, or odor to improve comfort and quality of life. Third, prevent complications like infection, maceration, or new skin breakdown. Every dressing choice, every intervention should move us one step closer to one or more of these goals. Key principles of wound care. To achieve those goals, we rely on a few key principles that guide all wound care decisions. 1, holistic assessment. So look beyond the wound. Consider the patient's nutrition, mobility, circulation, and comorbidities. 2, moist wound healing. Keep the wound bed moist but not soggy. A balanced environment helps cells migrate and tissue formation. You want a wound to be eyeball moist. 3, infection control. Always use clean technique and recognize early signs of infection. 4, pressure and shear prevention, repositioning, offloading, and protect at-risk areas. 5, patient-centered care. Include patients in all decisions. Tailor your treatments to their lifestyles and goals. When you focus on these 5 principles, your wound care practice becomes safer, more consistent, and more effective. So to summarize, as a nurse, you're not just treating a wound, you're managing a healing process. Your goals are healing, comfort, and prevention. And your success depends on following the key principles of holistic evidence-based care. If you found this helpful, make sure you check out the next video in the series, Anatomy and Physiology of the Skin, where we break down exactly how the skin heals and why every layer matters. Thanks for watching, and I'll see you in the next micro-learning session.
Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations,
Access to high-quality supplements, holistic healing,
digital resources, informative books, or high-quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.